can see a life together, standing by you, and I think I want to forever. And after all that's come and gone through all the years, I can't believe the moment's finally here. And you never looked so beautiful. You're everything I've waited for, and so much more, standing right in front of me. And we could weather every high and low. If love is going where we go to have it hope forever, let's start our life together. Let's start our life together. Let's start our life together.
Good morning, everyone. Thank you for joining us for this webinar this morning. So I am Kerry McCrickard. I'm Deputy Director at CHILD, the Centre for Holistic Initiatives for Learning and Development at the Yonglyu Lin School of Medicine here at the National University of Singapore. And it is my big pleasure today to introduce Professor Bryce McLeod, who's going to be leading our webinar this morning, which is titled Supporting the Social, Emotional and Academic Development of Children in Early Childcare Settings Using a Tiered Approach to Prevention. So we're really excited about this. I'm very excited. Bryce is a professor of psychology at Virginia Commonwealth University and a visiting professor here with us at CHILD and in the pediatrics department in the medical school. And he is an internationally recognized expert in implementation science, also in evidence-based practice for children and adolescents. And we're really excited to have him here today to learn. And I'm also joined by another fantastic colleague, Dr. Cheryl Sia. She is a developmental psychologist. Many of you, if you're sort of tuning in from Singapore, will probably know Cheryl already. She is a director at the Centre for Evidence and Implementation, and she will be facilitating some Q&A and discussion with Bryce after we've heard him talk. So I look forward to hearing from both of them later. And for now, hearing from Bryce. So a very big welcome. Let's get going with your talk.
Thank you, Carrie. Very excited to be here today. Going to be talking about supporting the social, emotional, and academic development in early childhood settings using a tiered approach to prevention. So I'm going to talk for about 40 to 45 minutes. And here's the agenda for my talk. I'm going to give a little bit of background about myself, where I work in the United States, and to provide a little context and kind of the perspective I bring to this work. Going to then talk about what is tiered prevention and why it is important in early childhood settings, what type of supports it can provide to early childhood settings. After I go over the background, I'm going to do an example of universal prevention, and I'm going to take an example from EASL that was developed here in Singapore in CHILD. And then I'm going to provide an example of secondary prevention in a program called Best in Class. At the end, I will kind of round out the talk by talking about challenges and next steps, some of the things that programs can think about if they are considering tiered prevention. And we will end with a Q&A session, which will hopefully last about 15 minutes or so. All right, a little bit from where I work and where I live. I live in Richmond, Virginia, which is a state in the United States on the eastern coast of the United States. the work that our team does is in the school systems within Richmond, and Richmond's the capital of the state of Virginia. The city itself, it's about 300,000 folks, and then everyone surrounding the city, it's about a population of 1.3 million. A lot of the school-based research that our team does is in early childhood settings with kids aged approximately 3 up until 9 in urban school systems primarily. So I work at Virginia Commonwealth University, which is an urban campus. It's a public university in the state of Virginia. My wife and I were drawn to Virginia Commonwealth almost 20 years ago because it's one of the few public universities in the United States that's community engaged. And by what I mean by that is the majority of the faculty who are employed at VCU are partnered with community members, and they work in a variety of settings, health settings, school settings, and so forth. It's a school of about 32,000 students, and it has a huge med school. And the reason why I'm sharing this is that what I'm going to present to you today on tiered prevention is a lot of the work is based on what is done in the United States, a lot of the research supporting what I'm presenting, and a lot of the concepts are used in early childhood settings throughout the United States. And I mention that out front because, you know, a lot of the principles having been developed in the United States may or may not fully generalize to other countries, other cultures, and other contexts. So I think it's important to kind of talk about my perspectives before I go in and talk about tiered prevention. And I'm happy to kind of chat a little bit about what may or may not generalize at the Q&A session. All right, so why is tiered prevention important? The idea of tiered prevention comes from public health. So out of public health, this idea of providing kind of universal supports to everyone, and then increasingly intensive supports as needs kind of increase, developed mostly in healthcare and then was generalized to other areas of like mental health, addiction, and education. So the idea of tiered prevention, when it's applied to early childhood settings, is the idea that if you provide these universal supports, secondary and tertiary supports, it helps promote child development. And this idea of it helps promote school readiness in young children. And what I mean by school readiness is that tiered prevention, by providing different levels of support to kids, helps promote social development, emotional development, and pre-academic skill development. Early childhood is a very, very important time for kids. The ages of 0 to 5, there's a lot going on developmentally. When kids are in early childhood settings, it oftentimes is one of the first times they're developing a relationship with an adult, with someone who lives outside the home. It's the time in which kids start developing emotion regulation. It's also when they start getting introduced to academic skills that help prepare them for later phases of school. So if you put the right supports in a tiered prevention framework, you can help promote social, emotional, and academic development, and you can promote skills that are important for later academic functioning, and also help prevent other problems to develop that might interfere with later academic success. All right, so a little background about what tiered prevention can potentially accomplish in early childhood settings. I'm now going to go through the different parts of the pyramid and tell you kind of what some of the concepts are at these different levels. Now, in preparing this talk, I tried to pull across different tiered prevention models that are used in early childhood across the United States. And towards the end of this talk, I have a slide. It's a resource slide that has different links if folks want to learn more about some of the models that are used in early childhood settings. So I'm not necessarily pulling from any one model here. What I'm trying to do is kind of pull across models. And across those models, one of the things that are very important for tiered prevention, and really the foundation of tiered prevention, is an effective workforce. And what I mean by that is educators who are ready, able, and motivated to deliver evidence-based practices. So evidence-based practices that we know, if delivered at different levels of intensity, can help support the social, emotional, and pre-academic development of children. In order to achieve the goal of an effective workforce, there's really kind of three primary requirements. One is educator training. And there's really two pathways to this. Educators can come to early childhood settings with education that helps prepare them to deliver evidence-based practices. And this can be through credentialing, this can be through coursework, and that includes not only kind of principles of child development, but also different practices that educators can use to promote social, emotional, academic development. The other pathway is through professional development offered through the early childhood setting. In the United States, and I think globally, there are different levels of credentialing that are required to be an educator hired into early childhood. When there are certain credentialing requirements, it helps ensure that educators may come prepared to deliver evidence-based practices. Often, what is more likely the case, though, is that professional development opportunities are often offered through the early childhood settings themselves. So that's the first requirement, educator training. The second is the system in which the educator works. Systems in which have kind of built-in supports for professional development, who have clear standards around academic requirements and expectations, and standards for social emotional development, where the system is valuing and kind of putting resources and time into professional development, is an important requirement. And the last is supportive policies. It's hard for systems and educators to kind of be prepared to do tiered prevention if there aren't policies that support, provide resources and standards that kind of put pressure on systems to deliver tiered prevention. All right, universal, secondary, and tertiary. I'm going to go into each of these levels a little bit more into detail now. As this figure demonstrates, universal promotion is designed to be provided to all kids within early childhood settings. So these are the foundational practices that educators use to promote development within children. Secondary prevention is conceptualized as intensified supports that are provided to 15, 20 to 20% of the kids who don't fully respond to the universal supports. This is still seen as prevention because the kids who fall into secondary prevention, they don't have a diagnosable problem, but they're showing signs that indicate that if those skill deficits are not addressed, they may have problems in later academics. And finally, tertiary. These are services provided to a relatively few number of kids. These are intensive, these are intervention, and they're typically delivered one-on-one. All right, so what is tiered prevention? Universal supports. Universal supports are the foundational classroom practices that educators use across an early childhood setting. These are practices that are intended to support the development and school readiness of children. Oftentimes in a universal system, the system in which the educators are working will have some core principles that they ask the educators to deliver. Those are practices that help provide structure, meaning rules and routines, kind of rules for kind of behavior, school-wide rules that are used to kind of guide behavioral expectations for the kids. It's also a way of interacting with the kids that help promote social and emotional development. A good set of classroom rules provides educators opportunities for in-the-moment teaching. When rule violations occur, it helps provide the means and a starting point to provide instruction that both promotes social, emotional, and pre-academic skills. And so the universal supports are designed really to provide a consistent set of expectations for kids and a consistent set of focus on pre-academic skills that all together help prepare kids to succeed at the next level of school. Many of the universal supports that are provided in the United States are built around two core principles. And the two principles are high quality supportive systems and nurturing and responsive relationships. In the United States, early childhood settings are strongly encouraged to establish strong connections with families. The thought being is that if you can develop a synergy between what is being done in the early childhood setting and what is being done in the home, that you will have a bigger impact on the development of that young child. So the idea is that if you can, in the early childhood setting, provide opportunities that promote social development by allowing the child to develop positive relationships with adults, positive relationships with peers, that provides a strong foundation for that child's social development. And if that is then mirrored at what's seen at home, then you will have this synergistic effect where you can support the social development of the child while also supporting their pre-academic development. The other principle is nurturing and responsive relationships. The idea here is, as I mentioned earlier, early childhood settings are often one of the first times that kids are developing relationships with a large number of peers and with adults who do not live within the home. Thus, how they go about developing those relationships and the skills that they develop around kind of how to develop relationships with adults and kids are very, very important. And so one of the reasons why this is one of the core principles is that the early childhood setting should help promote nurturing and responsive relationships among children and educators, and also at home with the families. So again, universal supports are general supports that are standardized across classrooms within an early childhood settings. Most of the tiered prevention approaches used in early childhood settings within the United States are kind of built on these core principles that emphasize high quality supportive relationships. And with that foundation, then teachers are encouraged to use practices that help promote social, emotional, and academic development. The next level, secondary prevention, are intended for kids who do not fully respond to the universal supports. In the United States, this is generally considered about 15 to 20% of the class. In the United States, a typical classroom can be somewhere between 20 to 25 kids. And so this means that somewhere in the neighborhood of 3 to 5 of those children will need more intensive support than what is provided at the universal level. Secondary prevention addresses specific needs. And those needs can come in the form of helping address social skills. So if a child is struggling socially, it can be around emotion regulation, if a child is struggling to contain maybe their anger, or they're sad, or they're having trouble kind of engaging in the classroom because they struggle with emotion regulation. It can also be academic skills. So if a child may be lagging behind perhaps in language or math concepts. So secondary prevention can kind of run the gambit of social, emotional, or academic skills. And secondary prevention can be delivered as part of normal classroom instruction or in small groups. And so what you often see is that kids who have a similar identified need will be pulled out of their classroom. They'll form a small group. They'll meet a couple of times a week for kind of specific focused instruction, and then they'll go back to their classrooms. So to summarize, supports provided at the secondary level are considered prevention. The idea here is to highlight kids who are exhibiting problems that are predictive of later academic problems in school. Those kids are then provided more intensified supports, either in the classroom or small groups, and those can last throughout the academic year. All right. What is tiered prevention? Tertiary intervention. So this is the top of the pyramid. This is the most intensive support. And instead of being prevention, this is actually more intervention. These kids are typically a fairly small percentage, and these are kids who have kind of displayed chronic unwanted behavior. And now on my slide, I put unwanted in quotes because I think it's important to kind of realize that that term unwanted varies across countries and cultures. In the United States, the behaviors in classrooms that are most predictive of subsequent academic problems as kids get older are being disruptive, showing poor academic engagement, meaning that they have trouble paying attention when a teacher is kind of doing academic instruction, or they may struggle when they're asked to do work, kind of focused work in a small group or by themselves. It also is signs of aggression if kids show aggression towards other peers and so forth. Kind of that group of behaviors that is often called disruptive behaviors is predictive of poor academic outcomes as kids get older. And oftentimes they are one of the main pathways by which children are identified for secondary and tertiary supports in the United States. What distinguishes tertiary interventions from secondary is that it's much more intensive, it's much more comprehensive, it's almost always done one-on-one, it's individualized to the child's needs, and it often falls under this umbrella of comprehensive interventions. Multiple professionals may be involved in the interventions. You may have the child meeting with a speech and language individual, a school psychologist, maybe some skill development. And this is because the kids are often showing multiple areas where they need help and support. And because the kids are oftentimes struggling to be maintained in the regular classroom. So they may struggle to be within a classroom without a lot of support and help. All right, so that was an overview of the different levels of tiered prevention. Some of the kind of ways in which early childhood settings often try to kind of enhance or optimize tiered prevention is through family engagement and data collection. The tiered prevention model is really built around this idea that if you can kind of help identify kids early on who are struggling, that you can then do early intervention at a lower dose and it can have a bigger effect for the child. So this idea that the earlier you identify potential problems, the earlier you can provide less intensive supports, and the more kind of bang for your buck you can get, meaning that you can help the child kind of return to an optimal developmental pathway. So in order to achieve that, universal screening is an important component of tiered prevention. And universal screening can go across both academics, so screening kids for different academic skills, screening kids for social and emotional kind of strengths or areas of need. Also monitoring classroom quality. So in the United States, there are defined areas of classroom quality. The federally funded early childhood settings use a tool called the class, and that tool measures different dimensions of classroom quality, and that helps early childhood centers know where educators have strengths and where they may need some help around professional development. And the idea here is if you do universal screening at the child level and you do monitoring of classroom quality, then you have the components needed to engage in what we call quality improvement. Those data can be fed in and be used by early childhood settings to make decisions about who to intervene with, how to intervene with them, and also at the educator level, it can help kind of provide extra coaching supports to educators who may need a little bit extra support in order to improve classroom quality. So there's the data collection side to tiered prevention, and there's also the collaboration with families. And as I mentioned earlier, many of the tiered prevention approaches used in early childhood settings in the United States are really kind of based around this idea of family collaboration. There's good data to suggest that the earlier you get families engaged in school, the more likely they are to remain engaged in their child's schooling as the child gets older. And so families are brought in, they're offered classes, they're offered opportunities to participate in school, to volunteer in school. And by bringing them into the early childhood setting, the idea is to, again, try to build that synergy between the practices used to support the kids in the early childhood classroom and those that are used in the family and at home. All right, so I'm going to go into some examples, one of universal prevention and one of secondary prevention. And the first one that I'm going to talk about is the easel approach. And I'm not going to go too in-depth in the description of the easel approach. It has been developed at Child here in Singapore. And it is a universal approach, and it is designed and intended to be used for all children in the classroom. It is led and delivered by early childhood educators and designed to help to be embedded in everyday teaching. It's evidence informed, and I think it's important that it was developed specifically for the Singapore context. It's for children aged 3 to 6. And if folks are interested in learning a little bit more about it, they can follow this link. To kind of just illustrate again where this kind of rests within the tiered prevention model, easel involves 9 different practices. Those practices are introduced to educators, and they learn how to use those practices throughout the day in the different types of activities they do with the children, whether they are kind of focused on social, emotional, or academic activities. The practices are really designed to help support both kind of social and academic competencies. The model for easel is common to many programs that are used in early childhood settings. It's a model that helps promote the professional development of educators. Educators attend a workshop. That workshop introduces the educators to the 9 practices, helps them understand what they are in isolation, and then introduces them to how they can be used together to support the children. Once the training workshop is done, they are then provided coaching where a coach will come and visit their classroom and provide them in kind of feedback, answer questions, and help support their use of those practices in the classroom. This training then helps lead to changes in the educator's instructional practices, and those changes have a positive impact on dimensions of classroom quality. So it improves the intention is to improve the overall classroom atmosphere, and this is kind of the quality of the learning environment. It also helps promote stronger relationships between kids and educators. And at the child level, it helps promote social, emotional, and academic development. And so it basically maps onto those school readiness skills that I was talking about a little bit earlier. And again, school readiness is really, early childhood is an optimal time for kids to learn the skills that map onto success in school. If you can kind of think about all of the things a child needs to do to be successful in school: raise your hand, wait your turn, get along with your peers, know your letters, know your math concepts. The more those skills are learned in early childhood, the more ready the child is to successfully take that next step as they go on to the next level of schooling. In this slide, what I've done, and I know it's pretty busy, so I'll give folks a little bit of time to digest it. What I've done here is that I've mapped the practices of EASL onto the dimensions of child functioning or classroom functioning that they are designed to promote. And what you'll see is that some practices pop up in multiple areas. And this is kind of a core concept that you try to do when doing programming in early childhood settings and other classroom settings, is that you try to select a number of practices that can be used to promote multiple areas of development within a child. So starting on the left, and I mentioned this earlier, rules and routines are absolutely critical for providing classroom structure. They really are the starting point for the rest of the practices. And they kind of provide the jumping off point for many of the other practices to be used. Because without rules and routines, you really don't have the appropriate amount of classroom structure from which learning can kind of be successful. So rules and routines, and then you have 5 practices that map onto the educator-child relationship. These are things like active listening, how to support a child, how to provide praise. These groupings of practices help, again, build a strong relationship between the children in the classroom and the educators. And that is a critical component of social development. We also have practices that map onto academic engagement, as well as social and emotional development. By providing rules, by providing praise, you help ensure that kids, or that the educator knows how to maximize engagement in academic activities and provide pathways to promote good social and emotional development. The 2 other practices that are under executive functioning are the only practices in EASL that are really focused specifically on skill development. Dramatic play and games promoting executive functioning are specifically designed to strengthen executive functioning. And the games one is kind of an iPad-based set of games that are designed to help enrich different aspects of executive functioning, like memory and attention and so forth. So most of the practices are more about kind of structuring the classroom and providing kind of opportunities for positive relationships with the educators, and executive functioning are specifically designed to kind of strengthen those executive functioning skills in kids. So that's an example of a universal program. I'm now going to turn to an example of secondary prevention. And as full disclosure, I'm going to talk a little bit about a program called Best in Class. This is a program that my colleagues and I have been researching for a little over 15 years at this point. And again, we have primarily been doing this work in Richmond and in another state, Florida. And this has been done in early childhood settings and with kids who are a little bit older. So this work spans age 3 up to about age 9. Now, if you remember when I was talking about secondary prevention earlier, I talked about secondary prevention is provided to kids whose screening indicates that there are particular skills that could be addressed in order to help kind of improve their social or academic development. Best in Class is developed specifically to address kids who display unwanted behaviors in classrooms. Research shows that in the United States, up to 1 in 4 kids in early childhood settings display unwanted behaviors, defined as poor social interactions, disruptive behavior, low academic engagement. And research also shows that those children who display those unwanted behaviors often have poor relationships with educators. And those kids who don't develop good relationships with their educators and aren't able to do so during their time in early childhood, if you look at their time through kind of age 3 to age 12, the kids never really get on track, meaning they continue to struggle to develop relationships with their teachers as they get older. They struggle with academics. They have very poor academic outcomes, and they are more likely to develop emotional and behavioral disorders when they get older. So in the United States, the quality of the relationship a child forms with their teacher or educator is predictive of a range of academic and behavioral outcomes later. So Best in Class is really designed to help strengthen educator-child relationships and reduce unwanted behaviors in children. Best in Class is a classroom-delivered intervention similar to EASL. And as you may remember, I talked about secondary prevention really falling into 2 categories. One is classroom delivered and the other is small group. Best in Class is kind of representative of that first group. The educators are trained to use a set of practices throughout the days to support the kids in the classroom who display higher levels of unwanted behavior. And there's a link there if folks want to learn a little bit more about Best in Class. But my point here is that Best in Class has 7 practices. And you'll see that there's some overlap between these practices and those that are used in EASL. Teachers and educators are trained to use the practices at the universal level. And then they are coached on how to use them at a higher intensity with the 3 to 5 kids who are displaying unwanted behaviors in their classrooms. Best in Class is considered a value-added model. And what I mean by that is that, at least in the United States, many of the educators have some level of familiarity with these practices. So when they're trained on them through Best in Class, it's often not the first time that they've been introduced to them. But what Best in Class does is help them understand how to deliver those practices at a higher intensity and with higher quality. Now, I know this is a busy slide, but it kind of goes through the model of what Best in Class is. And similar to EASL, Best in Class uses a professional development approach. Teachers go to a 1-day workshop, they get introduced to the practices, and then they have about 15 weeks of coaching. Those activities help increase their use of the practices, and research shows that by using these practices in the classroom, it improves the relationship with those what we call focal students, those students who are displaying higher levels of unwanted behavior. Typically, there's about 3 of those students in any classroom where best in class is being implemented. And the research shows that at the end of the school year, the teachers have improved their relationships with those children. Learning how to deliver the practices and being coached also increases what we call their self-efficacy. And that's their teachers or the educators' belief that they can deliver practices in their classroom that will have a meaningful impact on the kids in the classroom. And best in class has shown to kind of improve classroom quality, improve relationships, and reduce behavioral problems in the kids. Now, to give you a little bit of an example of how best in class works, I'll pull out rules as one practice because it's such a foundational practice in early childhood settings. So here's an example of what a classroom set of rules may be. So in best in class, what teachers learn to do is to develop a developmentally appropriate set of rules for their classroom. They learn how to display those rules prominently within the classroom. They are taught how to develop routines so that they review the rules on a daily basis. Usually in the morning, they'll create a song or a routine where they will go through and review all the rules and all the behavioral expectations associated with them so that the kids memorize the rules and understand the rules. Teachers are then taught how to deliver those rules in a more intensive way with the focal students. And this is an example of Avery, who is one of the focal students. So what the teachers would do is remind kids of the rules. So if the kids have been reading a book on the carpet and they're going to transition to working at small groups, the teacher may remind them of, remember, I want you to use your walking feet when you go to the tables. And then the teacher would then turn to Avery, who's one of the students who struggle a little bit more following the rules, and remind them specifically about what the behavioral expectations are. So again, best in class practices are used at the universal level, and they're intensified for the 3 or so kids who are the focus of the best in class program. Other examples, best in class again is a kind of a classroom-based intervention. There are plenty of examples of programs that focus specifically on skill building. So social skills, emotion regulation skills, pre-academic skills. There are some secondary programs that provide family support. So they bring families in, teach them skills that they can use at home with the kids. And some examples of those are banking time, friendship group, social emotional learning foundations. And these are all either one-on-one with the child. For example, banking time is an intervention designed to strengthen the educator-student relationship. And it's done by doing one-on-one playtime with the child, whereas friendship group and self are more skill building. All right, we're coming down the home stretch. Challenges and next steps. So how do you go about thinking about tiered prevention in early childhood? And I'll be honest here, one of the biggest challenges that I see is around workforce development. We've been working in early childhood settings for well over 15 years at this point. And it has always been a challenge to retain individuals within early childhood settings. And at least in the United States, it's become even more difficult following the pandemic. And so it's a real challenge to develop an effective workforce, engage them in professional development when there's a lot of turnover. People get through training, they stay for a little while, and then they leave, and then a lot of the knowledge that had been imparted to them through professional development leaves as well. So it's really hard to kind of build capacity and build enough folks sometimes within a building so that you can have that peer-to-peer coaching that is often so important of developing an effective workforce. It can also be challenging to figure out universal screening and measures of classroom quality. Many of the screening approaches and measures of classroom quality have been developed and validated in the United States, and they may not apply fully to other countries. They may not tap into the dimensions that are important in other countries. And so it can be a challenge if thinking about putting in tiered kind of assessment about how to go about doing that in a cost-effective way so that early childhood settings can engage in database decision making. And the last part is collaboration with families, how to go about doing that, how to bring families in, how to engage them in the process. All right. Acknowledgements. I do want to thank the educators, administrators, families, and children who have been part of the Best in Class work over the years, and the wonderful graduate students and staff who have supported that, and some of our funders. These slides will be available to folks. So here are some of the resources that I mentioned and some of the sources in which I drew from when preparing this talk. And I now can turn it over to questions.
Thank you, Bryce. I think it's very enriching and very comprehensive in what you have covered. And we have really a number of almost 30 over questions coming at you. I reckon we wouldn't be able to answer all of them within 15 minutes, but we'll try. Let's talk a little bit more about the context in Singapore. I think it has been really interesting with the contrast between what happens in the United States. There's plenty of similarities, and probably for us to think about some of the differences in terms of context in Singapore as well. So can you comment a little bit more in the way that for best in class, that is classroom delivered, is it also delivered to the remaining 80 to 85% of the students who don't display unwanted behaviors?
Yeah, and this isn't unique to Best in Class. I think this is many of the secondary prevention models that are delivered in the classroom are intended to provide educators with a set of practices that they can use with all children in the classroom, but then understand how to use them in a more intensified and focused way with a handful of kids who need a little bit more support. And so many of the programs that are like Best in Class, again, are trying to kind of put that universal foundation in place and make sure it's very solid, and then build upon that using the same practices by helping educators understand you're using the same practices, you're just using them in a much more targeted way. So you will single out those children who need a little bit more support, to remind them a little bit more about the rules, to go a little bit more out of your way to develop a good relationship with them. So of the different secondary prevention models that are done in the classroom, they typically, not all of them, but many of them do kind of have that similarity where the practices are intended to be used with all kids, but then in a more intensified way with the handful of kids that need the support.
That's really helpful, Bryce. And related to this question, and we're thinking a little bit more about screening and identifying students for secondary or tertiary intervention. How do we prevent an unwanted discrimination or social stigma that comes along when we identify these students, to be pulled out in a small group setting? How do we go about screening for them if, there has been ongoing debate between targeted screening versus universal screening? How should we go about that?
As part of developing an effective workforce, I do think it's important to kind of understand that part of it is understanding kind of recognizing kind of implicit bias, how screening can be done, and how to be sensitive if you are going to use pullouts, how to do it in a sensitive way so that kids do not feel kind of singled out and so forth. Universal screening is an important part of tiered prevention, but it also has to be done in a way so that it's fair and equitable across the kids who are in the classrooms. Teachers can often be the source of those who are doing the screening. Some of the more cost-effective measures are the ones in which teachers are filling out forms of indicating kids who need a little bit more support. But we also have to kind of realize that and be careful with our screening that it is fair and based in the literature. And so anytime you're pulling a child out of a classroom to provide services, you do run the risk of kind of putting them on the spot. And so it's important to be kind of sensitive to how kids are pulled out and what they're told and what the classroom's told. I hope that answers the question.
Yeah, that's fabulous. I think it also aligns with us being sensitive in the way that we're becoming a bit more child-centered, even in the way that we provide intervention and the way that we identify children and the way that we work with the parents, right, to get this going. So wonderful. And just going back to a lot of the questions that are related to the way that we would support our educators. I think there's a really good question about, you know, how process quality and structural quality supports are key in the way that we would support educators in delivering universal and tiered prevention type of support. Now, how can we support teachers and their families to ensure, you know, the fidelity of the implementation that we're delivering as intended? How can we support them?
So I think anytime folks are thinking about tiered prevention, the most important thing is to think about universal prevention. You know, in some of our best in class work, we've sometimes gone into schools where we tried to do secondary prevention and it didn't work because there weren't good universal supports in place. And so, and I saw some of the questions that came in kind of before the talk, and some of them were talking about kind of resources and so forth. I think that my opinion would be that the first step is figuring out what you can do at the universal level. How can you consistently define classroom quality, the practices that make up kind of the supports that you want to provide to kids, and then the professional development opportunities that can be used to support educators. And depending on the levels of resources of the early childhood settings, I think you have to almost think about keeping it relatively simple if there are lower resources, and then kind of remembering high quality relationships, family involvement, and a child-centered approach with good rules and structures provide an important foundation, even if you can't kind of add on other practices due to resource limitations. The more consistency that you can build in structure, the stronger foundation of those universal supports that you can then build on other things should you be able to. And so if you have a constant definition of classroom quality, you can monitor how educators are doing, and then you can see if you're delivering practices with fidelity, and you can provide them coaching if they're not. So I always take a data kind of approach to it. But providing that structure, measuring classroom quality, I think can help ensure fidelity.
Thanks, Bryce. I think that also requires a bit of that time resource from everybody involved as well, and having that buy-in as well, and that collaboration across teams of educators, center leaders, and principals, and how our system can allow that to happen. I think that's critical as well, isn't it, Bryce?
And that's part of the high quality system that I was talking about, is that when teachers are part of the process of providing, you know, it's sometimes the case where teachers help kind of judge classroom quality, but also are coaches for each other. And so the extent to which the system in which educators work, if they are forming a collaborative to support each other, then that can help kind of make it a nicer place to work, but also kind of support the fidelity and so forth.
Yeah. Wonderful, Bryce. Let's address some of the questions that related to our children and what they need to learn and what they need to be developing in their early years. So there are a few questions related to, is it sufficient for our young children to be playing more for their early development? Do they really need to be excelling in academics in their early years? And how do we in turn develop their learning and perseverance, towards the way that they're picking up new skills and to learn based on us wanting to develop their interest and child-centeredness and using play to develop them? How do we balance that, in the early years?
Play is important for development, and play is an important part of social and emotional development for young kids. Play is also something that can be used to promote skill development. I think if you remember, one of the ESOL practices is dramatic play, and that's a form of play that is done in a way that helps promote executive functioning skills. And so play is an important component. You can do skill development within play. But the broader picture here is, I think, is kind of what are the school readiness skills? They comprise social, emotional, and pre-academic skills. Different countries and cultures have different balances of how much play versus academic activities they do throughout the day. I have visited classrooms in various countries, and the structure does differ. But I think one of the key things in order to kind of promote that interest in academic activities is that you want to give kids a positive experience. And it's not just a positive experience with academics, it's a positive experience at school. You promote positive experiences with peers, you promote positive experiences with their academic activities. The more kind of they associate positive emotions with going to school, with interacting with their peers, with doing the academic activities, the more momentum that gives them and the more positive kind of, they get more engaged in academic activities. In terms of kind of play itself, it is an important part of development. I think there is a right balance between how much academics versus how much free play is done. I'm not sure that we know the exact correct balance there, but play is an important part of development. So.
Yeah, that's wonderful. I agree with you, Bryce. I think in a lot of contexts, even in Singapore as well, the idea of using play as a platform to teach our young children and following their interests, especially for our children who are disengaged, and just starting with what interests them and using play as a platform for them to learn and then to develop the other skill set that's essential to build their school readiness skills. I think that's a good way to start and to begin, but juggling, where the structure begins and how we introduce some of the classroom management skill set for educators to juggle that really well. I think that's how we can also support the workforce to be able to do that really well. It's not easy. I know we have 2 minutes. Let's quickly just cover one last question, and we could address all the other questions offline, and we could share the deck of slides as well with everyone. I think we all agree that school and home partnerships are very important and work hand in hand closely. And however, maybe some of our families do not quite follow or have the same beliefs or wanting to collaborate in the same way because our families are so diverse, especially in Singapore, where we all may be speaking different languages. So how do we engage families to partner with schools? And how do we support the system and policies that the school believes in? And I know it's a weighted question, but how should we engage and collaborate better?
No, it's an important question because I think that what I've learned about working in Singapore is that there is this kind of motivation to engage families, but there's a lot of cultures represented and a lot of languages. In the classrooms that I visited, I know that there are multiple languages being taught. And so the question is, how do you engage families in a way that respects their culture, their approach and values around family, and the time of the family, which may or may not be something that they have a lot of time to kind of go to school and attend. So my answer to that is I think it has to be done within the values of the different cultures. I know that you ha they're going to be having kind of different approaches to kind of thinking about what their role is with their child's school, what they want to see from their kids in school, the relative balance of academics versus not. And so, but providing pathways to parents to come and engage in the school, interact with the educators, for the educators to be able to reach out to them, but doing it in a culturally sensitive way is important, but it is challenging when you have as many languages and cultures represented as you do in the early childhood settings in Singapore.
Wonderful. Thank you, Bryce, so much for this informative session. I'll turn the time back to you, Carrie.
Brilliant. Thank you. Thank you both. Thank you, Bryce, for a fantastic, clear and very thoughtful, presentation and sharing, and also to Cheryl for those great questions, and our audience for all of those questions that you're dropping in. Just like Cheryl says, we'll carry on seeing if we can answer more of those. The recording for this session will also be made available on the website very, very soon, so you can rewatch, send at your leisure. But I've certainly learned a lot. I really loved the description and that emphasis on sort of holistic school readiness, that this is social, emotional, and pre-academic skills, and that emphasis on sort of the workforce, and that, really investing in the workforce in early childhood is not something we should dismiss. This is very important. So thank you all. Thanks for tuning in this morning, and we look forward to seeing you at some of our future webinars. Thanks again. Bye.
Look in your eyes, and I can see a life together. Standing by you, and I think I want to forever. And after all is come and gone,